Optic Nerve Sheath Meningocele, a case report and review of the literature. Ilson Sepulveda et al. Audio by Paper to Audio. Abstract. Optic Nerve Sheath Meningocele, ONSM, is a rare condition with only a few cases reported in the medical literature. The etiology is unknown. The condition is characterized by an expansion of the cerebrospinal fluid space surrounding the optic nerve, without associated inflammation or the presence of orbital or cerebral neoplasms at the apex of the orbit. The condition is characterized by the absence of specific symptoms, with the most common being blurred vision and retro-orbital pain. We present the case of a young patient who was admitted to the emergency department at an external hospital. A clinical examination revealed painless right exophthalmos. No additional neurological symptoms were observed. A computed tomography, CT, scan and magnetic resonance imaging, MRI, revealed an ONSM. Introduction. ONSM is a rare condition consisting of dilation of the nerve sheath that creates a cavity filled with cerebrospinal fluid, CSF, around the optic nerve without any underlying pathology. In 1918, Bain described primary dilation of the optic nerve sheath and referred to it as an optic nerve dural sheath cyst. Since then, a few cases have been reported. One theory suggests that the difference in osmotic gradient between the cerebral and perioptic subarachnoid spaces leads to fluid accumulation. Another theory suggests that congenital narrowing of the optic or cranio-orbital junction may lead to accumulation in the perioptic subarachnoid space. There are no characteristic symptoms associated with optic nerve sheath meningocele. However, blurred vision and retrobulbar pressure are common symptoms. An MRI of the orbits is often used to diagnose the condition, as it easily reveals a dilated optic nerve sheath filled with CSF. Due to the rarity of ONSM, there is currently no consensus on the optimal therapeutic approach. Case report. A 16-year-old patient was admitted to the emergency department of an external hospital with painless right exophthalmos. No history of head trauma or other neurological deficits was detected. A CT head was performed. The images revealed a well-defined hypodense cystic mass located just behind the right eye, with evidence of displacement of the extraocular muscles. There was no evidence of bone expansion or erosion. Fig. 1.
Figure 1 summary. The figure shows CT images of the head. The images depict a well-defined intraconal cystic mass. The mass does not show bone compromise, but does show displacement of the extraocular muscles. The mass is hypodense and homogeneous. There is no enhancement after intravenous contrast injection.
MRI demonstrate the presence of an expansive cystic process, measuring 19 times 23 times 21 millimeters, with well-defined by a thin capsule, located in intraconal space of the right orbit. It has a close anatomical relationship with. Discussion. ONSM is a rare condition involving dilation of the nerve sheath. This dilation creates a cavity filled with CSF around the optic nerve without any underlying pathology such as inflammation, orbital, or brain neoplasia at the apex of the orbit. Bain was the first to describe optic nerve sheath dilation in 1918, referring to it as an optic nerve dural sheath cyst. Garrity et al. Described an optic nerve sheath meningocele in a historical article on 13 patients. Since then, a few the optic nerve, which causes anterior compression, deformity, and displacement of the eyeball. In addition, the MRI showed signal characteristics equivalent to those of cerebrospinal fluid in all sequences. No significant anomalous enhancement was observed. Cases have been documented in the literature.
Image summary. This is a composite figure showing CT and MRI scans. The images depict an intraconal cystic mass. The CT scans show a well-defined mass without bone compromise and displacement of extraocular muscles, with no enhancement after contrast injection. The MRI scans reveal a retro-orbital mass that displaces the globe interiorly, with signal intensity similar to cerebrospinal fluid and no enhancement after contrast injection. The figure suggests the presence of an optic nerve sheath meningocele.
One theory suggests that the difference in osmotic gradient between the cerebral and periorbital subarachnoid spaces leads to fluid accumulation. This assertion is further in the walls or within the lesion after the paramagnetic contrast, gadolinium, intravenous injection, Fig. 2, substantiated by Lunari et al. That documented elevated protein levels in the CSF of an optic nerve cyst. Another theory suggests that a congenital narrowing of the optic or cranio-orbital junction may lead to CSF accumulation in the perioptic subarachnoid space.
Figure 2 summary. The figure shows MRI images. The images depict a retro-orbital mass that is hypointense on T1WL and hyperintense on T2WL, exhibiting a signal similar to cerebrospinal fluid. There is no enhancement visible following intravenous contrast injection. The mass causes anterior displacement of the globe.
Enlargement of the optic nerve or optic nerve sheath complex may be indicative of an apical neoplastic mass, such as a meningioma, vascular hamartoma, glioma, neurofibromatosis, von Hippel-Lindau disease, hemangioma, intracranial hypertension, or skull orbital fracture. ONMS does not present with characteristic symptoms. However, blurred vision, headache, retrobulbar pressure, and retroorbital pain are common symptoms. Typically, a MRI scan of the orbits is used to diagnose the condition, as it allows for visualization of a dilated optic nerve sheath filled with CSF. Some T2 weighted coronal images show a bull's eye appearance, representing the expanded CSF spaces around the optic nerve. The use of fat suppression techniques is an effective method for ruling out the presence of intraorbital tissue lesions and optic nerve compression. Furthermore, MRI provides a more detailed differential diagnosis of ONSM, including other optic nerve tumor lesions, such as gliomas or meningiomas, especially cystic ones. Due to the rarity of ONSM, there is currently no consensus on the optimal therapeutic approach. Treatment is customized to meet each patient's specific needs. In some cases, medical therapy with oral acetazolamide has shown positive results. In cases where no improvement has been observed with medical treatment, surgical decompression is the preferred option, especially when vision loss is progressive. In situations where progress is minimal or non-existent, observation may be a valuable approach.
Figure 2b summary. The figure is an MRI scan. The MRI reveals a hyperintense area with a signal similar to cerebrospinal fluid. This suggests the presence of fluid accumulation or a cyst-like structure in the region. The signal characteristics match those of cerebrospinal fluid, indicating a possible fluid-filled cavity or abnormal fluid collection.
Conclusion: ONSM is a rare disorder with no characteristic symptoms, characterized by the collection of cerebrospinal fluid in the subarachnoid space of the intraorbital portion of the optic nerve. The etiology of this condition remains unclear, underscoring the necessity for comprehensive diagnostic imaging. Among the available imaging modalities, MRI is regarded as the preferred study to guide treatment, which can range from conservative therapy to complex surgical repair. Therefore, it is essential to implement individualized treatment protocols to optimize patient outcomes.
Image summary. This is a logo. The logo depicts a clock tower alongside a silhouette of a human face. It seems to be the logo for a medical facility, specifically the SCRVICIOD Otorhinolaryngology, YCIRUJAD CABZA, YCULLO Hospital Guillermo Grant Benhaven.
SCRVICOD Otorhinolaryngology, YCIRUJAD CABZA, YCULLO